Healthcare and medication are the two major aspects we look into care about. Hospitals and nursing serve people to help achieve these needs. But still, there exist some problems due to the lack of proper hospitality and time consumption in medication. To help them overcome, our crew has taken efforts to introduce the wireless integrated health monitoring system. The system has temperature sensor, a pulse rate sensor, and a respiratory sensor. This is then followed by the amplification process and then further computation using the PIC microcontroller, which is being pre-programmed. We also have a GSM-based SMS transmission module connected to the microcontroller unit. The system starts with a sensor unit, which may be used for a physical connection by the patient. It includes the temperature sensor unit, where a thermistor is used to measure the temperature. This sensor is internally calibrated to read data in terms of Fahrenheit. Next is the pulse rate sensor, which obtains the heartbeat rate of the patient and a monitor. It is a clip-type sensor which uses an infrared LED and an IR receiver. Once they are worn, there will be a continuous IR ray transfer, which may be interrupted by the blood flow, due to which an output is generated. We have used an LED to determine if the sensor is under a proper working condition. It is then followed by the respiration sensor system, which also uses a thermistor to detect the change in resistance. We will then allow the sensor to distinguish between inhalation and exhalation. Here, exhalation may cause a change of plus 5 volt due to change in resistance. The heart of our project is the PIC 16F877 microcontroller unit. It has the necessary pre-programmed instructions such as the threshold levels, which are used for further computing.
This is the LabVIEW interface, which shows the visual display for the health monitoring. The data are acquired by VISA module from controller using the COM port. The read buffer reads and gives the values for temperature, pulse, and respiration respectively. The data can also be refreshed manually, and the values are being recorded in a separate registry. This shows the temperature, respiration, and pulse rate values for a normal human being.
Finally, once the threshold detection occurs, the microcontroller unit links the GSM transmission module for sending a text message. This includes all the current data which is required to the authorized medical advisor or a doctor for making the arrangements for medical prescription.
The system looks very simple, but it's really worthy. The system is similar to coin-based telephone system or a ATM machine. So the system can be placed in the hospitals where the patients can interface directly and gain knowledge about their health directly, and also a prior information is sent to the doctor.
That the patient need not enter the cabin each time for taking prescriptions and readings from the doctor. And moreover, the readings will be sent to the doctor before even the patient enters the cabin for treatment. And one more thing is that the concept can be placed in intensive care unit for further medication, and they can be still more classified. And we are also planning for a concept called doctor kiosk, which is being under construction, because that is an intelligent device which is capable of monitoring the patient placed in public, and also deliver its own prescription based on the readings which is being taken. Thank you.